recently, the leadership of the University College Hospital Ibadan Alumni Association were guests on the morning show here on Arise News, and in the course of the interaction, outlined efforts being made to raise the sum of 2 billion naira aimed at establishing a cancer center in the institution. The response to that clarion call has been immense. Latest information confirming that chairman of the Guardian newspaper group Made in Hebrew has donated 10 million naira to that effort, while a collaboration with the Nigerian Communion of the Anglican Church is at an advanced level. Joining us now to discuss how the institution has been able to mobilize its alumnus to raise funds for the project is Professor Prof Omigbodun, who is Provost, College of Medicine, University of Ibadan. Good to have you on Newsday. Well, I'd like to ask you, first of all, can you tell us how much you've been able to raise so far in this your quest to establish a cancer research center?
Okay, sorry, I need to correct it. I'm not raising funds for a cancer center. So I think the news item is wrong. We are raising funds to build a student hostel for the College of Medicine, University of Ibadan students. So I think there's maybe a bit of a mix-up there.
Well, thank you very much for that clarification. So can you just tell us more, about this, your desire to build a student hostel and how the alumni is reacting so far?
Thank you very much. We are here, we are an academic institution, the College of Medicine, University of Ibadan, and we train students of the health professions, medical, dental students, physiotherapy students, students of biomedical health professions, and also students of human nutrition and dietetics. And so we have several students. And we have an accreditation requirement that all medical and dental students should be accommodated within the University College Hospital campus where we are based. And so we found that about 50% of our students are not accommodated within the University College Hospital. And they are clinical students. They're supposed to be able to access the wards, the clinics 24/7. And so we had this big project before us to raise 2.5 billion naira to be able to build a hostel that would accommodate the students of the College of Medicine, University of Ibadan. And we felt that the best way to do this was to reach out to our alumni, because we have alumni all over the world who are doing wonderful things, and so on and so forth. So we set out ahead, did the design, did the plans, and then we reached out to our alumni. And one of our very, very distinguished alumnus, who is based in the United States of America, who is happened to be my classmate. That is Philip Ozoa. He's a professor of pediatrics. He's actually presently, that's Philip O. Ozoa, MD, PhD, is the president and CEO of the Montefiore Medicine, an umbrella organization for the Albert Einstein College of Medicine and Montefiore's health systems. And he reached out when he learned about this plan to build a hostel. He was my classmate in medical school. We graduated 1985. He reached out to me and said he wanted to support my leadership and vision. And then I asked him to give a keynote address. And I also asked him if he would be a launcher at this program. And I left it to him. And so we had a Zoom meeting where we had people who were online with us. We also had distinguished alumni. We had many people. The chairman of council of the University of Ibadan was there. We had the vice chancellor. We had members of the UCH board. And Philip Ozoa, who is, like I said, the president and CEO of Montefiore Medicine in the US, gave a keynote address titled From Initiative to Finitiative, an Academic Journey, basically telling us how he had gone right through from graduating here, MBBS, in 1985 to becoming the president and CEO of Montefiore Medicine. And this is actually an umbrella organization for the Albert Einstein College of Medicine and Montefiore Health Systems. Under him, he has like 13 hospitals, 300 clinical locations, and he runs a $8 billion US dollar annual revenue. And so he gave a keynote, a fantastic keynote, which is up now, published on, put up on the College of Medicine website. And at the end of giving that keynote, he then pledged a pledge to give the College of Medicine, University of Ibadan, $1 million US dollars as to support the bid to build this 2.5 billion naira project. So that is a background to what exactly happened. And we just, yes, so I don't know if you have any other questions.
Yes, definitely, Professor. It sounds extremely impressive. It's good to know that alumni still care for the schools even after they've left. I want to know how much out of that number you've been able to raise, or everyone's been able to raise for the housing.
Well, like I said, the housing is going to accommodate over 600 students, which should take care of our needs. And so we have many blocks. Well, with this, this $1 million pledge, that is a great start for us. So we are an estimate, at least we have a good enough to start a good project and build a couple of blocks. Like I said, we're going on, the entire project comes to over 2.5 billion naira. So we still need a lot more donations from people. But I must mention that the alumni across the world are already doing a great job. People are bringing in funds. They're donating funds to this, pledging funds. And so we are banking that this is going to be done majorly by the alumni of the College of Medicine, University of Ibadan, who have, all over the world have done great and wonderful things. Thank you.
Fantastic. Now, I might be wrong because there was a mix-up earlier on, but from the understanding that we have, do we still have you, Professor Olayinka?
I'm here.
Great.
Thank you. Yes.
From the understanding that we have, you rose to this occasion because of the fiscal crisis that's facing the government. I'm just wondering how you might have felt, when you received the news, the federal government was justifying, the 1 billion, over 1 billion naira that it gave, for the purchase of vehicles for the government of Niger Republic, in terms of prioritizing that and not necessarily prioritizing what, your needs are in terms of education and everything that's going on with this project. How did you perceive that?
Okay, the first thing is that I think it's important that we change the caption. I'm not University College Hospital fundraiser. I'm the provost of the College of Medicine, University of Ibadan. Oh. So that is I'm under the University of Ibadan. Okay. University of Ibadan is under the Ministry of Education, whereas the University College Hospital is under the Ministry of Health. So even though I am cited, we're a university. Our students get their clinical practice and clinical work in the University College Hospital. But this is a fundraising for students of the College of Medicine, University of Ibadan, the hostel. Now, with regards to issues of budgeting and priorities, one of the things that I have looked for as a leader in the College of Medicine is that I have, like the model that happens in many world-class universities abroad, Harvard and even Cambridge, Oxford, Stanford, and Princeton, top world universities, alumni take up a large proportion of the work of running those universities. I'll take a university like Harvard. Harvard has the highest endowment of any university in the world. And they don't wait for government to sort things out. One of the things that I have proposed is that, generally speaking, that it's important for the government to consider, handing over the old universities to alumni to run. For example, Harvard has an endowment worth 36 billion. That's number one in the world, followed by Yale, 26 billion, and so on and so forth. So as universities, citadels of learning and education, research, I would suggest that the university hands the running of this to that, particularly the old universities. We were started in 1948. We are well over 70 years old, and we have alumni that are well placed all over the world. So I think the government can look critically and prioritize and say, okay, let's try an experiment. Let's hand you over to the alumni, and then they can maybe support with salaries. Because you find that in many of these universities, they are really free to run and express themselves. And that really brings a lot. And then you find that one of the things that Dr. Philip Ozoa spoke about was how he could rise up the system was because merit. He rose up to become president and CEO of Montefiore Eastern Medicine because of merit, because he has the ability. So I think that if there's a hands-off of government and then we can then do things in our own way. I'll give another typical example. A lot of the world-class universities depend on research grants. Research grants do a lot of funding. They bring in, for example, Dr. Ozoa, who leads the Albert Einstein College of Medicine, one of the nation's premier centers for research, medical education and clinical investigation. He receives more than $200 million in annual research awards from the NIH. He has, several doctors, PhD students. One of the things that we can encourage is to have research grants. The College of Medicine, University of Ibadan is very, very privileged to have a lot of research grants. Unfortunately, these grants, which have come from the US government, the British government, are kept in the single treasury account. That is the central bank. And that is actually affecting a lot of our research work. Because when the US government gives me an award, a money to do my work, they also give me a time limit. They give me like 6 months to accomplish this. But if the money is kept in the single treasury account, these are what we call third-party funds, then it stills my ability to hit the road running. Because many times it takes sometimes up to 6 months or more to be able to get the money going. So these are some of the areas. So I'm saying that the old universities, we can depend more on research, more on alumni, and then the government can provide loans and funding, like loans and also for loans and scholarships to students. So I'm not focused on what the government's priorities are in terms of whether they are buying cars for another country. I think that we need to restructure our system and address the priorities, because a country's needs to focus on education. It is from education that you get discoveries, that you get research, that you get innovation and creativity. So that is what I'm saying, that let's see how we can hit the road running if we have that freedom to get our grants and also to get, put systems that would work on merit in place. Thank you.
Professor Prof Omigbodun, Provost College of Medicine, University of Ibadan, thank you so much for joining us on Newsday.